So I'm going to go ahead and introduce Dr. Wright. As I said, he's the Acting Assistant Secretary for Health here in HHS headquarters in Washington, D.C. And John, you've been in that role since February 2017, and it probably seems like a lot longer than that because I know it's been an incredibly busy time for you.
It is.
But Don is really somebody who, he's like the expert in everything. And when there's a gap and they need somebody to come in and fix something, it's Don who usually steps in to do that. And because of that, he's overseen a variety of programs and activities here in the Office of Assistant Secretary for Health. His full-time role is overseeing the Office of Disease Prevention and Health Promotion, ODPHP, as we call it, which is really the home for Healthy People 2020 and soon to be Healthy People 2030, which is kind of our nation's roadmap for addressing pretty much every health issue that there is to be addressed and sets goals that we use to measure our progress against. He's also, in his office, has dietary guidelines for Americans, physical guidelines for Americans as well. Another part-time job, overseeing the President's Council on Fitness, Sports, and Nutrition. And before he joined OHADIP, he was Deputy Assistant Secretary of Healthcare Quality. So Don, I mean, really a illustrious career and just genuinely a good person to work with, too. So Don, why don't you take it from here?
Thanks, Rich. Your remarks, your introduction was far too generous. Well, good afternoon, everyone. I'm so pleased to be with you here today on this webinar addressing what we can do all do to reduce new cases of viral hepatitis and to improve diagnosis, care, and treatment of people who are living with hepatitis. I'm excited and energized to see that so many of you share my commitment to this work and have joined us for today's webinar. Honestly, I confess that I'm worried about what we're seeing in regard to viral hepatitis. Frankly, we've been losing ground to the opioid epidemic, which has not only led to an increase in injection drug use, opioid use, and overdose death, but we've also seen the cases of hepatitis C increase 300% over just the last 5 years. Hepatitis B rates are going up in states that have been hardest hit by the opioid epidemic. And sadly, hepatitis C among pregnant women and the risk that the virus will be transmitted to their infants has increased in states like Kentucky, Tennessee, and West Virginia. You know, these are just some of the reasons we need to join Secretary Price in his fight that he's leading against prescription drug and heroin use and misuse in the United States. There are also the reasons that we need to get behind the National Viral Hepatitis Action Plan. Each of us needs to know what we can do in our organization and in our communities to move us closer towards our national goals by preventing new infections and improving diagnosis and treatment of viral hepatitis among all Americans, including those in priority populations that we will be talking about today. Clearly, the federal government can't do it alone, and we need you, our partners, to do what you can if we are to turn this tide against the epidemics of opioid use and viral hepatitis. Let me say here in my office, the Office of the Assistant Secretary for Health, or better known as OASH, there's been a tremendous response to the National Viral Hepatitis Action Plan. Its development and implementation have been excellent examples of collaboration in OASH and across government. Dr. Walitsky's office, the Office of HIV, AIDS, and Infectious Disease Policy, leads this effort in partnership with more than 20 federal partners. This includes offices and agencies across the Department of Health and Human Services, the Department of Justice, and the Veterans Administration. Just within OASH, the 10 HHS offices and the regions, and our six of our staff offices here in headquarters are all doing their part. Fortunately, you'll be hearing from leaders of 2 of these offices today. First of all, Dr. Beth Collins-Sharp from the Office of Women's Health, which supports work to better address viral hepatitis needs of women in a variety of ways. And she'll be talking to you in just a few moments. In addition, you'll hear from Dr. Matthew Lynn, our new Deputy Assistant Secretary for Minority Health in the Office of Minority Health. But we also have important efforts underway in the National Vaccine Program Office, which focuses on vaccine policy and is currently working to improve vaccination rates for both hepatitis A and hepatitis B. The office that I lead, the Office of Disease Prevention and Health Promotion, is the home of Healthy People 2020, as well as the Healthcare Associated Infections Initiative. The Office of Population Affairs, which has included hepatitis vaccination and testing in their guidelines on improving quality family planning services. And lastly, the Office of the Surgeon General, which is addressing HIV and viral hepatitis in its work to end the opioid epidemic and to increase awareness among all healthcare providers about the increase in new infections. Now, this kind of cross-governmental effort is critical for complex health problems like hepatitis B and hepatitis C. There are no easy solutions to improving the lives of people at risk and infected with viral hepatitis. But through collaboration and in innovation, we can make greater progress towards our goals. Although we still have a ways to go to 2020, when the current action plan expires, I did want to acknowledge that work is already underway in our Office of Disease Prevention and Health Promotion to develop the vision for Healthy People 2030. Every decade, the Healthy People Initiative develops a new set of science-based 10-year national objectives with the goal of improving the health of all Americans. The development of Healthy People 2030 includes establishing a framework for initiatives and identifying new objectives. We will work to ensure that Healthy People 2030 objectives support our work to achieve the goals of the National Viral Hepatitis Action Plan, continue to coordinate our federal efforts, and encourage coordination in states as well as among our non-federal partners. This is the best way to maximize our collective efforts. I wish that we did not need to address these issues in Healthy People 2030 and that we could say we've won the war against viral hepatitis. I think Healthy People, the Secretary's 5-pillar plan to fight the opioid epidemic, and the National Viral Hepatitis Action Plan all put us on a path towards elimination of viral hepatitis as a public health threat. I'm looking forward to hearing today more about what you're doing to make this vision a reality. Thanks to all of you for the work that you do. We certainly could not see progress without you. Thank you.
Thanks so much, Don. And I think I'm feeling torn emotions from your presentation. I think you unfortunately did such a great job grounding us in the reality of the challenges of today, but then also focusing us on the opportunities and the potential that's ahead of us. I feel happy and sad simultaneously. And I think that's the reality of what we grapple with. There's the potential to do better, but the need's so great that we don't always have the ability to meet it. So now I want to introduce another colleague from our OASH family, and this is Dr. Beth Collins-Sharp. She's the director of the Division of Program Innovation in the Office of Women's Health here at HHS. Now, I didn't know this about you, but before this position, she held several leadership positions at the Agency for Healthcare Research and Quality, including that as Senior Advisor for Women's Health and Gender Research. And she was also Senior Advisor for Nursing and the Director of Evidence-Based Practice Centers. She served on the faculty of 3 major university schools of nursing and has practiced in several women's health settings. So, Beth?
Thank you. Thank you, Dr. Walitsky, and thank you, Dr. Wright, for all of your support for efforts on viral hepatitis. The Office on Women's Health is really pleased to be part of this discussion because the health consequences for women are often considered to be less significant than is actually the case. Women are included as a priority population in the National Viral Hepatitis Action Plan, and that includes topics beyond pregnancy. Women are often the family caretakers and the decision makers about health care in the family. So it is important to include women when considering health issues such as viral hepatitis. Finally, women tend to put the health needs of their family above their own health needs and may write off symptoms like fatigue, minor abdominal pain as unimportant and ignore them entirely. When we consider hepatitis B in women, women make up about 45% of those who have a chronic infection. Among newly infected individuals with hepatitis B, women account for at least 1 in 3 cases. So therefore, hepatitis B is recommended overall for people at risk, which includes anyone born in countries where hepatitis is common, which is most commonly the Asia and African countries, where it's important to note also a number of the births there are home births. It also includes any women from these countries who come and then have children born here in the U.S. as well. Since pregnant women can transmit hepatitis B to their unborn baby, all pregnant women should be tested for hepatitis B during pregnancy. And about 1,000 babies are born with hepatitis B each year, and 1 in 4 of these are going to die earlier in their life course from complications such as liver cancer. So women can protect their babies from hepatitis B through vaccination, of course. CDC recommends that all infants get their first shot before leaving the hospital. In the case of home births, then there needs to be close follow-up to make sure that they get that first vaccination early. And new hepatitis B vaccines have increased in some states related to the opioid epidemic, as Dr. Wright just mentioned. And women who have substance use disorders should be offered testing and vaccinated to prevent hepatitis B. And this is a population that's really difficult to reach at times. Now let's change the focus a little bit and talk a little bit about hepatitis C. Women account for about 2 of every 5 cases. And we'd like to highlight, in the case of hepatitis C, baby boomers for a moment, because hepatitis C is 5 times more prevalent among baby boomers compared with adults of other ages. These are the people born between 1945 and 1965. We often think of baby boomers coming of age in the 60s as wild flower children who used injection drugs and had wild and free unprotected sex in the California gardens. However, for many baby boomers, this is really not the case. Baby boomers on the older end of the boom, and by the way, my father and mother were both born at the beginning of the baby boom. I was born at the very end of the baby boom, so the implications are different for us, even though we're both part of this baby boom generation. So baby boomers on the older end of the boom may have been infected with hepatitis C as children during routine medical procedures. And this was a time when needles and syringes were sterilized and reused. Or they may have been born at home without a skilled birth attendant or in unsanitary settings. Both of my parents, for example, were born at home with family and non-medical personnel attending them. For female boomers on the younger end of the boom, like me, they may have had a cesarean section when blood transfusion was a common practice for all surgeries, but particularly for cesarean section, or received a blood transfusion for another reason and gotten infected via that route. Viral hepatitis prevention and testing then is part of healthy aging, as much as we don't want to think about the fact that we're aging or that hepatitis would affect us at all. So therefore, all women born between 1945 and 1965, and you know who you are out there, should be tested for hepatitis C at least once, regardless of your risk behaviors. And finally, when you think about prevention efforts, remember that not all baby boomers are watching game shows in a nursing home. Many of us are still in the workplace setting. The good news is that treatments for hepatitis C now cure more than 90% of people who are chronically infected. So it's important to identify people with this chronic infection. Now moving then to consider new infections. Among the newly infected people with hepatitis C, women are impacted almost equally compared with men. But the number of women being infected is growing, probably as a side effect of the opioid epidemic. Young women are experiencing a more rapid increase in new hepatitis C infections when compared to young men. And the rates of hepatitis C infection among pregnant women has increased 200%. 200%. Of course, this puts their infants at risk also and creates a whole new cohort of individuals who can then become chronic infected with hepatitis C. Finally, of course, pregnant women who inject drugs are at increased risk for viral hepatitis and should be tested for hepatitis B and C during their pregnancy. Now, I don't like to end on such a negative note, so I'll simply say that women across the lifespan need to be included in all issues relevant to viral hepatitis. There are effective screening and treatment strategies available, and there's really never been a better time to use them to improve the health of women and girls. Thank you.
Thank you so much, Beth.
Certainly.
Appreciate it.